About the deadly coronavirus officially hitting the U.S. Here's what we know. A Washington state resident fell ill after returning from Wuhan, China, where the outbreak began. Officials now say more than 400 people have been sickened and 9 people have died.
COVID-19 is hard to believe that we are just about 2 years into this pandemic, and the impact that it has had for healthcare across the board is profound.
Alarming uptick in coronavirus hospitalizations.
Right now, there are 65,000 patients receiving care across the nation. That's up by 20,000 compared to 1 month ago.
A lot of rapid changes in healthcare. We quickly closed down services.
Pennsylvania hospitals are under growing pressure because of rising COVID cases.
New data compiled by the New York Times shows Pennsylvania is now first in the country in the average daily number of people hospitalized with COVID.
2 years ago, a world pandemic changed the way we live our lives to this day, hospitals being the main industry affected by the rapid spread of COVID-19.
Hi, I'm Dennis Flieger, the president of the St. Luke's, Quakertown, and Upper Bucks campuses. In my role as the president of the St. Luke's and Upper Bucks campus, I have the responsibility to determine strategy, ensure quality, and the financial performance, as well as our employee engagement for both of these two campuses. We started here at the St. Luke's Upper Bucks campus in December of 2019. Prior to that, we were at the Quakertown campus, which was located in the borough of Quakertown. That original campus started in 1930 and served us well over those years, bringing healthcare to our community. However, we were landlocked there. So this the new campus at Upper Bucks gives us 30 acres to continue to build and to expand services here to better serve our friends and neighbors. So healthcare is a huge part of every community, and one of the things that we understand is that when you have strong healthcare in your community, it tends to bring other businesses along with it. In the last 2 years, as St. Luke's has expanded to the Upper Bucks campus, we've invested close to $200 million now in our local community. This is by increasing jobs, increasing at our local campus, as well as we employ a lot of local construction workers to do the projects. So these projects really do help stimulate the overall economy, which makes a great place for people to stay and live. One of the other things that we do is we partner a lot with our education partners. And this looks in regards to, we have a seniors program where we work with the seniors of several local community high schools here, and we provide them an opportunity to explore healthcare opportunities for the future. By doing that, it gives seniors that chance to see whether healthcare is really what they want to go into. So they spend a couple days a week with us going over and shadowing different positions throughout the network so that they're able to see whether or not really this is what their future wants to be. The final way we do it is with summer meals programs. This is for our low-income children throughout our region, and every summer we offer them the opportunity to come to St. Luke's for 2 hours in the afternoon where we provide fresh food for them, as well as community-supported agriculture, where we bring bags of fresh vegetables in for the families each week, so that every week we're trying to enhance the ability of families that are at risk for better health choices, which then help drive their future health needs.
My name is Heather Rizzo, and I'm the Vice President for Patient Care Services at the St. Luke's, Upper Bucks, and Quakertown campus. My primary focus is on making sure that the team that is taking care of our patients provide high quality of care and safe patient care. So most of my responsibility is spent working with our nursing staff. So our registered nurses, we have LPNs, we have patient care assistants, and I like to spend a lot of time out talking with my nursing leaders, rounding. One of my favorite parts of my day is doing leadership rounding, where I am in talking with our patients, looking for opportunities for improvement, as well as what has gone well when they're here during their stay. Love to hear from our patients who they want to recognize. And then working with the team of folks that we have. So we have a lot of new nurses here on the campus. This campus has been opened for just about 2 years. So working with them and making sure that they have the things that they need to be successful in their role. St. Luke's benefits the Quakertown and Upper Bucks community in many different ways. This campus here, as I mentioned earlier, is a new campus. We've been open on the Upper Bucks campus for just about 2 years, and so we serve a need in the community, most recently with opening a new NICU and labor and delivery unit in August, and so that is a need in the community. Families love to be able to come here and deliver their babies here. We also have an emergency department. We have seen about a 25% increase year over year on this campus, so we're meeting the needs of the community to meet their community health needs. Additionally, we provide lots of different services in the community as far as meals for children who come from different families. We're always looking for ways to partner with the community and make the community better.
So after we moved in December of 2019, 3 months later, the world turned upside down as COVID took over the world. During that time, we had to make a lot of rapid changes in healthcare. We quickly closed down services, moved into telehealth medicine, where we were having our physicians see patients at home via Teams or Zoom. We also started to figure out how to care for patients that came down with the COVID disease. Initially, during those first phases, there was a lot of uncertainty. Our staff was stressed, they didn't know what was going on, and there was a lot of new treatment modalities that were coming out in order to help treat these patients moving forward. We did see a high death count initially.
So COVID-19 is hard to believe that we are just about 2 years into this pandemic, and the impact that it has had for healthcare across the board is profound. Specifically for nursing, I'll address it from a nursing perspective. So we have seen nurses that have left the profession primarily due to the pandemic, through early retirements or folks needing, in the beginning, early phases of the pandemic, needing to make a choice about staying home with their families. At this point, 2 years into the pandemic, people are very tired. Healthcare professionals often have patients who are very angry and family members who are angry, so they're not always treating their providers and their nurses respectfully, so that can be very upsetting for the workforce. There are nurses that had experienced a death of multiple patients that they never before in their career had experienced. So I would say, in summary, really the biggest impact that COVID had on nursing is just feeling very overwhelmed and burnout.
I'm extremely proud of the work that St. Luke's did during this. It was an extremely challenging time, but one where you got to see why people choose to go into healthcare is because they truly care about the people that they serve. And our staff stood on the front line every day for the last 2 years, and I really could not be more proud of them.